This is WAB's Week in Review, the show where we look back the last few days of stories from your WAB News team. I'm Alex Helmick, managing editor of WAB News. And later on the show, one father's fight to make sure health insurance companies and medical providers follow state law when it comes to mental health. That's in about 10 minutes. But first up, the state school superintendent says Georgia teachers should get additional raises, and he says staff, like bus drivers and maintenance workers, should get competitive pay as well. WAB's Molly Samuel had more.
The past few years, the state has boosted teacher pay, but State Superintendent Richard Woods says Georgia should do more. He says he wants teachers and certified staff to get an additional $10,000 over the next 5 years. And he says people who teach for decades should keep getting raises based on their experience. Woods also says the state should pay more to people who earn leadership degrees. And he calls for a competitive salary schedule, health insurance and retirement benefits for staff like nutrition workers, bus drivers, and paraprofessionals. A large chunk of state spending goes toward education every year, and Georgia has a multi-billion-dollar budget surplus. Molly Samuel, WABE News.
Staying on schools, chronic absenteeism in Georgia, that's when a student misses a 10th or more of a school year. It's still a problem, and it's well above where it was before the COVID-19 pandemic. And as WAB's Mei Shu told us, some schools are tackling the issue from multiple directions to get students back in the classroom.
During the pandemic, the rate of students who were chronically absent in Georgia soared over 20%, double what it was before. This year, Georgia Governor Brian Kemp signed Senate Bill 123 into law, which in part requires some districts to establish attendance review teams. There's no single solution for the problem because there's no single cause. Charity Trowbridge is the director of attendance improvement at Fulton County Schools.
Whether it's a student behavior, a family behavior, whether it's barriers, whether it's something systematic within a community, like attendance is the result of something that's happening.
Some school districts use a model called MTSS, or multi-tiered system of supports, to keep kids on track. For at-risk students, it can involve regular check-ins with adults and individualized support. Dana Price is a member of the Cleveland Avenue Elementary School's Chronic Absenteeism Review Team.
Then we also make sure we remove barriers by calling them and saying, hey, are we going to need uniforms? Are we going to need, undergarments?
Sarah Von Esch is the director of student support for Forsyth County Schools, which has been able to lower its chronic absenteeism rate to below 10%.
We have great nonprofits that work alongside us, so that is a challenge for other systems that may not have that availability of resources or personnel or staff to support them.
A Georgia State Senate study committee is currently exploring further interventions and support programs that can help combat chronic absenteeism in the state. Mei Shu, WABE News.
Attorneys are gathering Northwest Georgia residents to continue fighting against extensive chemical contamination in the Dalton area. WAB's Marissa Mecki had the details.
Northwest Georgia is becoming a hotspot for lawsuits over a family of chemicals called PFAS. Attorney Nick Johnson with the group PFAS Georgia says Dalton's PFAS comes from its biggest industry, carpet.
It's water resistant, but most importantly for this part of the state, it's stain resistant.
But PFAS is also linked to adverse health effects like cancer and fertility problems. And in Dalton, Jackson says residents have shared with PFAS Georgia their stories of local health issues.
People started to tell us, my 22-year-old son has testicular cancer. My 23-year-old daughter just got diagnosed with uterine cancer and had to have a complete hysterectomy, and she'll never be able to have a child. These are real-life stories that we've heard.
Testing by PFAS Georgia, as well as testing by the government, universities, and nonprofits, has demonstrated Northwest Georgia has PFAS contamination much more widespread than the rest of the state and a lot of the rest of the country. Jackson says they've expanded the number of tests they've been doing beyond water to include indoor dust and soil.
We have what we believe is the most comprehensive testing program in the country on a private basis.
Attorney Ben Finley says the carpet industry knew of PFAS's contamination and needs to be held accountable, but residents are at risk of footing the bill for cleanup. Finley says last year, his group rallied locals from Dalton to speak against House Bill 211 at the state legislature, which proposed shielding carpet manufacturers from lawsuits over their PFAS pollution.
And I think about like David and Goliath. And if this ain't David and Goliath, I don't know what is.
He says they have 16 cases filed on behalf of 50 individuals and multiple entities, claiming decades of PFAS pollution from several carpet and manufacturing companies has caused health impacts and tanked their property values. And while a lot of suits like this get settled and never see court, he's hoping next year these suits will go to trial. Marissa Mecki, WABE News.
Well, a formerly condemned apartment complex in College Park is officially reopening after tenants were forced out earlier this year. It's a move the city hopes will be the start of rehabbing current buildings for affordable housing. WABE's Dormaya Vance reported the story.
Chelsea Gardens Apartments was closed for unlivable conditions. Its tenants were given just a short window to leave before the complex was shut down. Now the property is getting a second chance. Here's College Park's Mayor Bianca Motley-Broom.
We have to look at the properties that are already present in our communities, figure out how we work with them, how we update them, how we make sure that all of our residents have access to safe, stable, decent housing.
Officials say the revamped complex, now called the Ivy at College Park, will have nearly 450 units of designated affordable housing. Maria Buchanan is a consultant with the property's management group, Contour Companies. She says there was some effort to rehouse former Chelsea Gardens residents.
We reached out to as many as we could contact that still had good contacts because we wanted them to see that we didn't just see what they were going through, we felt it. We heard it, and we took action.
However, advocates say there are still residents dealing with displacement since the condemnation. Phase 1 of the renovations is underway, with plans to start leasing units soon. Dormaya Vance, WABE News.
Early voting starts today, that's Saturday, November 22nd, for Atlanta City Council and Atlanta School Board runoff elections. Advanced voting for the December 2nd runoff elections run until November 26th. 2 Atlanta City Council seats are on the ballot. That's District 7 and District 11. As for the Atlanta Board of Education, runoffs are on for District 2, District 6, and an at-large seat. Find polling locations at wabe.org/2025 election. Well, there's a backlog of more than 100,000 cases in immigration courts in Georgia alone. That number climbs by the tens of thousands every year. Some of these court proceedings are open to the public. WABE's Emily Wu Pearson reported on a growing group of volunteers listening into hearings to keep an eye on what's happening in immigration court.
How are you? So I am getting everything pulled up online. Great. And I'll show you what it looks like.
On an early weekday morning in Atlanta, Lauren Waits clicks through a Department of Justice website.
And the dog will be quiet in a minute or two, I would imagine.
That's one of her dogs, Novio, barking in the background. She's logging on to watch immigration judge James Ward hold bond hearings at Stewart Immigration Court in Lumpkin, Georgia.
Oh, look, and it's already got me in there, observer.
Waits volunteers with the Georgia Asylum and Immigration Network's Court Watch program. The nonprofit launched the program to collect information about bond hearings, so attorneys and advocates in the region can understand if there are trends when it comes to judges' decisions about immigrants asking to be released from detention.
These hearings are public, and so the public should be in them, and they should be aware of how the immigration system is functioning.
Adriana Heffley is the legal director at GAIN. She says if more people were aware of what happens in immigration court, that could help battle some of the misinformation about the U.S. immigration system.
There's this myth that it's really easy to win asylum. And we know here in Georgia as immigration attorneys that that is the furthest thing from the truth.
Judges at Stewart Immigration Court, which is attached to Stewart Detention Center, historically have had some of the lowest asylum grant rates in the country, according to data from the nonprofit Transactional Access Records Clearinghouse. Immigration judges are appointed by the U.S. Attorney General. Even though the Trump administration is increasing deportation goals, it's firing judges at an unusual rate. And unlike immigration enforcement and detention, the immigration court system isn't getting billion-dollar infusions from the Trump administration.
Okay, so the bond hearings are over.
The judge at Stewart set bond in 2 cases. While the hearings are public, they can't be recorded.
So the last name was Paredes, and the A number here.
Waits takes her notes and fills out a survey for GAIN about what happened in each hearing. She details the attorney's arguments and the judge's decision. The attorney says the man has lived in Georgia for many years with deep roots, including U.S. citizen children. The judge is concerned because the man has made no effort to attain status in the country. The attorney asked for the man to be released on a $3,000 bond.
The attorney, Griggs, provided a whole lot of letters, including from the church, the co-workers, and a state rep, Rep. Carpenter.
That's Republican Georgia State Representative Casey Carpenter. The man in detention lived in Dalton in Carpenter's district. The judge granted the man bond at $5,000, but the Department of Homeland Security reserved the right to appeal, and the deadline was set for December, meaning he could go back to detention if the government appeals. And his case would add to the backlog in immigration court.
And so just being able to witness what is happening. And
Heffley from Gaines says she wants the public to understand immigration court
and counter some of the misinformation, or maybe releasing some previously held beliefs that were not entirely accurate.
And she says she wants to shine light on a system that feels hidden. Emily Wu Pearson, WABE News.
And for more from our Detained in Georgia series, go to wabe.org/detention. And a note of disclosure, Lauren Waits worked at WABE from January to June of 2015. You're listening to WABE's Week in Review with me, Alex Helmick. Georgia insurance companies are required to cover mental health the same way they cover physical health. It's a concept called parity. It's been state law since Governor Brian Kemp signed the landmark Mental Health Parity Act 3 years ago. Advocates say it's a critical roadmap to improve mental health and addiction care. But as WAB's Jess Mador reported, too many Georgians face roadblocks to getting the help they need.
Kyle Boehm was a junior in college when a mental health crisis landed him in the hospital.
He was experiencing a psychotic episode. He was close to 21 when he was diagnosed with bipolar disorder.
That's Kyle's father, Roland Boehm. He says the diagnosis was frightening.
There's a significantly higher level of suicidal ideation, suicide plans, suicide attempts.
Boehm is an attorney. At the time, he worked for a giant international corporation with health insurance that covered most of the treatment his son needed.
We had access to care. We had some of the best providers. You know, it's a completely different story than most people who are challenged with mental health illnesses.
Mental health care can be hard to come by in Georgia for the more than 1.4 million adults and more than 100,000 adolescents with a mental health condition, the National Alliance on Mental Illness, or NAMI, reports. And if it is available, it's much more likely to be out of network, Research Triangle Institute finds. More than 8 times more likely compared to medical or surgical visits, despite the state's 2022 Mental Health Parity Act. The law mandates insurance companies cover mental health and substance use equally with physical health care. Insurers aren't supposed to limit doctor visits, charge more for care, or deny standard treatment. But too often, says Kim Jones, that's exactly what happens.
If you need a particular treatment and then your insurance says we don't cover it and they force you into a lesser expensive treatment, that would be a parity violation.
Jones heads NAMI Georgia. The group is documenting patient parity complaints. They include difficulty finding a provider, insurers limiting doctor visits and meds, and charging more out of pocket for mental health deductibles. Jones says the red tape is also difficult for providers. For some, it's an incentive to stop taking insurance altogether.
And be cash-based only, which means the people who need the care the most are rural areas, our Black and Brown communities are getting served less.
And that often means paying more too. More transparency at the state and federal levels would help patients and providers navigate their treatment options, says Atlanta psychiatrist Dr. Ben Hunter.
Understanding how they are reimbursing general health versus mental health claims and, kind of what their denial rates are for each various type of treatment.
Hunter is chief medical officer at Skyland Trail Residential Psychiatric Facility. He says most of his patients experience coverage losses in the middle of treatment.
Upwards of 40% of our patients will end up paying out of pocket for some services before they leave due to a loss of insurance authorization.
It's a problem Georgia officials acknowledge. They've uncovered more than 6,000 parity violations statewide so far. And earlier this year, for the first time since Georgia's Parity Act took effect, Insurance Commissioner John King announced the department would begin fining companies found violating it. It's the kind of enforcement advocates like Roland Boehm want. His son Kyle's bipolar disorder meant years of cycling from inpatient care to outpatient programs, psychiatrists, and medications. Eventually, he was able to go back to college. He graduated and got a job in his field. He did well until, Boehm says, 8 years after diagnosis, when 29-year-old Kyle took his own life.
I would have liked for him to have been among that group that battled for decades. But I also think that he benefited significantly from working with psychiatrists, psychologists, so that he could make the most out of each of the days that he had.
Boehm is part of a coalition that pushed for passage of Georgia's Mental Health Parity Act in the General Assembly.
It is the best state parity act that's out there. We're not getting the enforcement we need, but once we get that enforcement, we will show you how to solve all of these things.
And help more struggling Georgians access the care they need. Jess Mador, WABE News.
This story is from a partnership with the Carter Center's Mental Health Parity Collaborative. If you or someone you know is struggling, help is available day or night. Call, text, or chat 988. That's all for the show this week. I'm Alex Helmick. My thanks to the WABE News team for all the great work. And thanks to you for supporting WABE and for listening to the Week in Review.